Hey there, health warriors. When we think of hospital safety, we often focus on patient care areas, but behind the scenes, there are hazards hiding in plain sight. Today, we're talking about confined space safety in healthcare. Whether you're part of engineering, facilities, or biomedical maintenance, knowing how to identify and safely manage confined spaces can save lives. Let's break it down. A confined space is an area that is large enough for someone to enter and perform work, has limited or restricted means of entry or exit, and is not designed for continuous occupancy. In healthcare, examples include boilers or utility vaults, steam tunnels and crawl spaces, large autoclaves and sterilizers, underground service shafts, HVAC ducts or mechanical rooms. These areas may seem harmless, but they can quickly become deadly due to lack of oxygen, toxic gases, or limited visibility. Working in confined spaces can expose staff to oxygen deficiency or enriched environments, toxic gases like carbon monoxide or cleaning chemicals, flammable vapors, temperature extremes, electrical hazards or moving equipment, and entrapment or collapse risks. These hazards can lead to serious injury or death within minutes if proper precautions are not followed. Permit-required confined space, or PRCS, contains a hazardous atmosphere or potential for engulfment. It requires a written permit, air testing, a trained entry team, personal protective equipment, and an emergency plan. On the other hand, a non-permit confined space doesn't contain or have the potential to contain serious hazards. It still requires caution and clear procedures, but no formal permit process. Most confined spaces in hospitals fall under permit required if they have active utilities, limited airflow, or potential gas exposure. Authorized entrants are trained staff entering the confined space. Attendants remain outside to monitor, communicate, and assist in emergencies. Supervisors ensure the permit process is followed and rescues are ready. Untrained clinical staff should never enter confined spaces. Always notify engineering or facilities if access is needed. Confined space entry steps. First, identify the space and post signage. Clearly mark and restrict access to known confined spaces. Second, conduct a hazard assessment. Test for oxygen levels, flammable gases, and toxic substances. Lock out or tag out any connected equipment. Third, follow the permit process. Only trained personnel with valid permits may enter. Document who is entering, the hazards, and the timeframes. Fourth, wear proper personal protective equipment. Respirators, harnesses, helmets, gloves, whatever is appropriate for the hazard. Fifth, maintain communication. Use radios or voice contact with the outside attendant at all times. Finally, have an emergency rescue plan. An emergency team with retrieval equipment must be ready before entry begins. Never enter a confined space alone and never ignore posted warnings. In healthcare, safety doesn't stop at the patient's bedside. Whether you're maintaining life-saving equipment or supporting infrastructure behind the scenes, understanding confined space safety can protect your team and prevent tragedy. Have you or your facility encountered a confined space situation? Drop a comment below and share how your team handled it. Your story could help others. Like this video? Hit that thumbs up. Subscribe for more healthcare safety, compliance, and facilities education.